So taking the discussion about the resident training program, I would be starting this session with this discussion on the ocular sonography. For the residents, my points would be that how are they supposed to do or they not. So why this skill training is important? That's because the ultimate goal of any PG residency program is to cultivate a comprehensive clinical care. That means what? That means we all know that the present residents are the future beholders to the society for the complete eye care to diagnose, treat, or even the timely referrals also. And as MCI lays the guidelines about the PG training program, it also emphasizes that there is a need to produce the competent specialist who enables them to carry out their duties in all the ethical way. Also, when we talk about the international forum, that's about the ICO, again it lays the guideline and emphasizes on training and understanding the skills to such an attitude and to such a level that the ophthalmic specialists who are under their training period, once they are into full-blown ophthalmologists, definitely they are self-dependent to handle all the clinical scenarios. And again, coming back to a country like ours, that's a developing country like ours, that's India, and one of the flag bearers of providing quality eye care. We do have an additional responsibility to train our residents so that they can contribute in the way they are expected to. Now coming to the particular skill which I am talking about here, that's ocular sonography. The role of the sonography is not only limited about scanning or doing the ocular biometry or taking care of the axial length. It is much beyond that. That is especially when we talk about the ocular tumors or the orbital pathology, especially the choroidal melanoma. We can say that starting from seeing the lesion size, planning the radiation treatment, and also when it comes to monitor the response to the treatment. It all requires every time the sonography for the patient. So even this is re-emphasized by a study done by Armed Forces Institute of Pathology, which said that in their particular group, 5.5% of eyes which were enucleated for melanoma had undergone cataract surgery. And they re-emphasized that if had it been that sonography would have been done before the surgery, probably the intervention would have been taken a different shape. So this emphasizes the need for performing sonography in all the patients who have a dense, unexplained unilateral cataract. And looking at the magnitude of problem, that's a doctor-patient ratio in India, which accounts for 50% of world's blind population. One ophthalmology, we have to cater for 90,000 population. That means a huge crowd is waiting in the waiting line. So again, looking at this doctor-patient ratio, it gives an additional responsibility to train our residents to all the skills at their very basic training period, so they are confident enough to handle the patient who is coming with a common complaint of defective vision also. So a timely referral and a correct referral can be done to the tertiary level care. That's because the net gain giving, that's we are causing a filtering at the primary level. So tertiary level, the patient crowd is less. So actually the patient who need the care at tertiary level, they are being taken care of. And again, coming back to the primary level, as we have been talking about the camp posting, the resident and the junior doctors are the first contact to the patients. And if they are able, because of this trained skills, definitely they can take the instant decision, saving a lot of time and agony for the patient also. So in all, to conclude, we can say that we all can help a step for the National Program for Control of Blindness by better skill acquisition, saving the time for referrals, and sharing the responsibility of the goals set by the NPCB. So again, coming back to the ocular sonography or the particular skill I'm talking about, that's A scan or B scan, though we know it's difficult to master. But as we say, that practice makes a man perfect. And a step taken by AIOS, we can see the difference of the particular skill I'm talking about from the 20th century to the 21st century. And let's conclude this presentation from my side that yes, if the residents are being trained in a particular skill in a particular way, definitely it lays the career foundation while protecting the interest of the patient. Thank you. Now